Hello, Singapland. My name is Michael Graglia. Today is Wednesday, February 12th, and this is episode 161 of Singap 10, the Singap 1 podcast. Let me start by saying that yesterday, Tuesday, February 11th, I got the chance to visit one of our corporate partners and give a long presentation about Singap, everything from the science to the clinicals, to the incidents, to the community, to SRF. And it was really exciting to have yet another company start asking real questions about Singap and to show interest. And I just got to tell everybody out there that they are paying attention to this community. They see what we're doing, and it's just another company that is considering going after Singap 1, not entirely because of SRF, but certainly we are necessary, while not sufficient. What I mean by that is an activated patient community that shows up, that takes part in trials, that feeds natural history studies, that donates and accelerates science, that engages, is something that not all diseases have. And by having that, and by being so public about it through this podcast, through all the work we do, we are getting companies to say, maybe we can work on Singap 1, maybe we can do trials with them. So it's working, guys. It's working. Keep it up. In the spirit of keeping it up, I want to congratulate Amber and Ed and Virginie and countless other people who worked on our impact report. It came out yesterday. If you go to our impact page, curesingap1.org/impact, I think you get our impact page, which has this report and previous reports. Impact 24 takes you to the actual report. And there's also a press release written by Jo Ashline. And Jo Ashline can write, people. I mean, reading her stuff is just a treat. And she wrote a pretty long, honestly, press release about this impact report that really details and sort of summarizes the whole thing. It's incredible. Read the impact report. Share it with your mom, your dad, your brother, your sister, anyone and everyone. Tell them, hey, this is the organization I work with. This is the group working to help my kiddo with Singap 1. Isn't this impressive? Don't you want to support them? Share this report out with people who have donated, with people who you think might donate. It's important work, and we're going to do it every year. And this first one, honestly, I said, guys, just give me a 5-pager. Let's just get out an impact report and start from there. And Virginie was like, no, we're going to do this. We're going to do it right. So thank you, Virginie, for pushing the envelope there. It's great work. Study of the week, the Beacon Dreem. I want to thank Dr. J from Beacon for doing a webinar this week. If you didn't watch it, please do. We gave Jay a chance to talk at our conference, but we didn't give him enough time, and it was really frustrating because he's so good. So we asked Jay to come back and do a webinar. He's a very generous and kind man. He did the webinar for us, and he talked about EEGs and about what the Beacon Dreem is, and he told us that with industry support, so companies are paying real money for this. With industry support, we are doing a study right now. So you can sign up. Watch the webinar. You can sign up. You can get a Beacon Dreem sent to you. It is a device that you would wear on your head. No glue, no stickers, no nothing. You just stick it on the Singapian's head when they're asleep, and it collects EEG all night long. And what we want to do is just a feasibility study. We just want to show that this tool works, that our parents know how to use the app. Who doesn't know how to use an app? That we can collect this data, and that Beacon can collect data on Singapians. And what that would allow is for Beacon to be included, hopefully, in clinical trials, where we would be able to see, imagine if instead of going to a hospital and dealing with the EEG tech and having all that glue on your kid's head and having to give your kid a haircut afterwards and all that madness, you could just stick a device on your kid's head every night, and that EEG would just go over the internet to all the people who needed to see it, and you would never have to leave the comfort of your home. Hallelujah. Take part in this Dreem study. Industry has spent real money to make this happen. We have been working with Dreem for years to get to this point. It's a huge accomplishment. Thank you very much. There's another study happening at Colorado Children's Hospital. As you know, Children's Hospital of Philadelphia, CHOP, has a natural history study for Singap 1. And it's painful to fly across the country, frankly. And also, we want multiple sites involved. Why do we want multiple sites? Because we want to show the FDA that this data can be collected at any kind of hospital, right? So in addition to CHOP, SRF has spent lots of money to get a clinical trial site at Children's Hospital of Colorado, CHOP. We have funded it for, I think, 3 years. And every year they've agreed to see roughly a couple dozen of patients, right? These spots, if you do the math on what we spent and the number of patients they're going to see, are costing us more than $5,000 and less than $10,000 each visit. Each visit. That's what we're paying for Dr. Abbott's time, for the clinical care, for the research they're doing behind the scenes. There's a couple spots in April and a couple spots in May that are open. If you are on the West Coast or on the Mountain Coast and you haven't yet been to the natural history study this year, go to Colorado. Let's use all these spots up. I want every spot at CHOP filled. I want every spot at chalk filled. Why do I want those spots filled? Because I want that data in our natural history study. I want these incredible clinicians. We have recruited the best and the brightest. Dr. Gillian McKee, Dr. Megan Abbott, under the leadership and tutelage of Dr. Helbig and Dr. Demarest and Dr. Banke. All these incredible neurologists are here trying to learn about SYNGAP. Guys, this is our moment. And by the way, who wouldn't like to spend a day with a bunch of clinicians who've seen a bunch of SYNGAPians who can tell you how your kid's doing and how they can do better? It blows my mind these spots aren't signed up for a year in advance. There's spots in April and May at Colorado. Go, go, go. I also want to talk about Stanford. Stanford will hopefully soon be a natural history study site. We're working on that, and we just raised a lot of money for that. Stanford put out an article yesterday about Dr. Knowles and her work on SYNGAP1 with SRF, funded by SRF. It is an incredible article. So after you send your friends and family the impact report, be like, hey, check out this article too. This article is great. I want to thank Stanford and Stanford Medicine for doing this. I want to congratulate Dr. Knowles for getting her work profiled. The Stanford Medicine magazine is not a small publication, guys. A lot of important people read this, and they're all now going to learn about SYNGAP1. I share a tweet, a LinkedIn, and a Facebook in there. Really excited about it. Briefly, one of the reasons I'm so excited and committed to that particular grant is because when I read about Dr. Knowles and her work, I called her and I said, I feel like your theory really explains SYNGAP and I want you to work on SYNGAP. And she's an incredibly kind and gracious woman. And she was like, oh, I'd love to, but I'm so busy, so much going on. I said, no. We have a fund. We are happy to support research. We would like to support this work in your lab. We would happily fund a postdoc. And she was like, oh, well, if you can fund another postdoc, let's do this. And she just jumped right in. And that partnership has led to more and more work at Stanford. It's led to hopefully a clinical trial site at Stanford. It's led to Dr. Knowles and her colleagues, who are some of the best and the brightest, Dr. Lee Messer, to really focus and think about SYNGAP. And let me tell you what her theory was. Her theory was certain types of seizures, generalized seizures, of which absence are, cause the myelin in the brain. The myelin is like, think about the plastic on the wires. It's the sheaths around the neurons, right? Causes the myelination, the process of making myelin in the brain to break. And that bad myelination then causes the brain to have worse and worse seizures. Right? That is what's going on with SYNGAPians. If you think about it, they start with absence seizures around age 2, and those absence seizures happen for some period of time. And then for some reason we don't understand, our kids start having drop seizures. Right? And I said, our kids are living your theory, Dr. Knowles. I think there's something here. You should work on SYNGAP. And she is. So loved seeing this article. It's a great way to learn about SYNGAP. It's a great way to see SRF in action. Read that Stanford medical article and go to the Twitter, LinkedIn, Facebook, and share those, retweet them. Tell people about this article. It's super important. Research update. We are in week 7 of 2025, and there are now 8 papers on PubMed. On SYNGAP1. This is pretty exciting news because we're more than one a week, and that puts us on track to beat last year where we had 54 papers, more than you've ever had on SYNGAP. Why do papers matter? Do papers cure kids? Not really, but they give companies the comfort to get more engaged in SYNGAP1, and they give us more knowledge to fight SYNGAP1. So these publications really matter, and we are doing an incredible job of cranking out research. We got a lot of people contributing here, and this week's contribution came from Dr. Stanfield and colleagues at Edinburgh. It's called Profiling Autism and Attention Deficit Hyperactivity Disorder, ADHD, Traits in Children with SYNGAP1-Related Intellectual Disability. So if you are in the process of fighting for an ADHD or an autism diagnosis, this paper might be helpful to you. It's very accessible, very well written. Check it out. It's open access. Links in the show notes. Okay, let's broaden the aperture a little bit. Advocacy shout out. Later this month, February 24th through 28th, the Every Life Foundation will be doing their Rare Disease on the Hill week. It's an incredible opportunity to meet your congresspeople, your senators, and their staff, and to advocate for rare disease. Every Life Foundation does all the work. They set up your meetings for you. They give you a briefing the day before. They send you in there with other people from your state. It's a beautifully run operation. All you got to do is show up and do what you're told, and you get to build important relationships and advocate for your kids. So if you're near DC or you like DC, go to that. Links in the show notes. There's another learning opportunity I want to mention briefly. April 8th and 9th, so now I'm a few months out. St. Jude is having their translational science seminar. I went to this when it was in person a couple years ago. Really impressive people at St. Jude. Yes, St. Jude are the cancer people, but they're getting into pediatric neurology. And St. Jude gets things done, and they're good at complex care. So if you remember, Praxis did their SCN2A ASO study at St. Jude. So St. Jude's a real player in this space, and this meeting is very high level. So it starts with like, how do we identify these diseases? How do we make these therapies? What are the practicalities of delivering them? And it ends with like a session on the ethics of it all. It's incredibly good agenda with some star-studded people presenting, and it's virtual and it's free. So, maybe tell your parents about it. If you got to go to work, maybe tell your friends. It's a pretty cool seminar and a great way to learn about the rare disease space from very smart people. So good job, St. Jude. I will see you online April 8th and 9th. I want to also mention, I think it was this morning in the Kelly Clarkson show, Terry Privalakis shared about SPG 50. Kelly Clarkson, great platform. Terry is one of my heroes and friends, and he's been talking about, he spoke in the Kelly Clarkson show about rare disease so eloquently, and he just nailed it. So incredible work, Terry. Someone's going to call me and be like, hey, this guy found a gene therapy for his kid in 3 years. Why can't we find a therapy for our kids? Why aren't we moving faster? I want to point out, SPG 50 is a terrible degenerative disease. For Terry, the clock was ticking. If he didn't do this, he could have lost his son. And he took a lot of risks, and he moved really fast. And I have nothing but admiration for him. But we are not in that boat. And I want to be clear here. Our strategy was different, right? On the planet, there are about 100-ish kids with SPG 50, right? At that point, you have zero hope of convincing a company to go after this disease. And Terry talks about this on the show. We had 364 in our first census, and today we have over 1,500. And our strategy has always been not to raise lots and lots of money and make a medicine and give it to our kids, because that's a lot of risk, right? If anything goes wrong, all your eggs are in one basket, number one. Number two, our kids are not dying, thank God. And so the regulatory burden is different, right? The regulators are going to be a lot less risk tolerant about putting an experimental therapy in a kid who would otherwise live. So you have to understand, like, we are being very intentional with our strategy of de-risking SYNGAP1, of getting SYNGAP1 to be something that is interesting and safe for as many industry partners as possible, and then working like crazy on the open questions. What will we measure in trials? Sign up for the Dreem study, right? Is there a good enough natural history study? Go to Colorado, go to CHOP, right? We are being thorough about finding things that are giving people pause about working on SYNGAP1 and attacking them so that more and more companies go after it, so that we don't really care, frankly, if it's Stoke or if it's Praxis or if it's the latest technology that Jeff Coller just cooked up, or if it's whatever Rick Hugoneer is doing. We don't care which one of those therapies works, as long as one of them works. And we're going to let the market decide, and we're going to let companies go out and raise lots of money and do this work. Our capital is catalytic. What we are doing is de-risking the field and getting as many people as possible to come in. So God bless you, Terry Privalakis, for everything you've done for your son, Michael, for being on the Kelly Clarkson show, and for talking about rare disease. But before, and I can almost name the people who were going to send me this email, before people reach out to me and be like, hey, he did this, why haven't you done this? Like, I'm working hard over here, guys, and our strategy is different. Okay, but props to Kelly, Terry, and watch the Kelly Clarkson show. Links in the show notes. Fundraising, guys, it's all about money. Everything I just said takes money. People are working. We now have staff. Lauren is working hard. Everyone knows that. Dr. Catherine Helday, our CSO, was running around California going to visit labs at Berkeley and at UCSF just last week. Virginia is cranking on all cylinders. These things cost money. People cost money. The science costs money. We need to raise funds. We need to keep working hard to get industry involved. So please help us raise money. Big thank you again to Aaron, who dedicated his 100K effort on Saturday news update. Aaron lived, which I'm grateful for. Links in the show notes if you want to donate to that. Guys, anytime you do anything, raise some money. By the way, on Saturday of this week at 1 o'clock Pacific, Virginia, our COO, and Anthony Navarro, our Chief Fundraising Officer, are going to be doing a webinar about Sprint for SYNGAP. Sprint for SYNGAP will be in April. It's a great opportunity to raise money for SYNGAP. We want to have a sprint in every state. Really, it's just, hey, throw an event, do a party, do something. There's lots of blogs and videos on the website about what people have done before. This is a chance to have an event for SRF. Invite your friends. There's t-shirts. There's all kinds of assets. There's swag. Go to the webinar on Saturday, learn about it from Anthony and Virginia. We're trying to make it as easy as possible this year for you to have an event to A, raise money for SRF so we can fund more science and de-risk SINGAT, but B, so you can get all the people in your neighborhood to understand that this is a terrible disease that your child's got. And here's the kid, and here's the organization, and you can help. And that is in your interest. It is in your interest to help as many people as possible understand what you're dealing with and to help you help them by raising funds for the fund. Wrapping up, conference is December 4th and 5th. Not too early to block that on your calendar, to think about plane tickets, to see who you know in Atlanta, and to plan on coming and joining us. The conference is a huge event, and this year it's going to be a very big deal. I have a strong feeling about this. If you haven't volunteered with SRF, please do. Links in the show notes, social media, LinkedIn, YouTube, Twitter, Insta. We are everywhere. Please follow us, like us, retweet our content. If you're newly diagnosed, you made it this far, congratulations. Please check out singap.fund/resources. The community is here for you. We have all been newly diagnosed. We have all been through the hell that you're in. We want to help you with it. Reach out to us. Corey is amazing. Our community is here to welcome in all the families so that we can work together to help all our children. This is a podcast. Please give me 5 stars and share out the content so people can see it. By the way, I love the comments on the YouTube, right? If you have comments about this, put it in the YouTube. This is on YouTube. It's great to see the exchanges there. Thank you very much for listening. I will see you next week.